I'm Steve Meehan for the Kent Pilot, and I welcome Bill Webb, who's Kent County's health officer. Bill's been at the center of the local response to COVID-19 since the pandemic struck early this year. Bill, welcome.
Good morning. Thank you for having me.
What is the forecast regarding COVID-19 as we head into the fall?
So as we are looking at our current infection rates and positivity rates, our numbers are quite positive. I mean, in terms of it's quite low. As we go into the fall, we're expecting a certain seasonal increase in cases. We have seen with other types of viruses that have similar characteristics that they have a seasonal capacity. We don't know whether this will, but we're expecting it. So an increase in the number of cases is likely. At this point, we're trying to ensure that it's not an overwhelming increase.
Tell us about the trends in positivity rates in the county.
Since July 21st, the Kent County positivity rates, which is a 7-day rolling average of the total number of positive cases, has been well below the state average for at least 2 months now, and that's a good thing. Kent County is positioned in a very good place geographically for this particular COVID pandemic. We have we're rural in character, we have a low population density, and we have a demographic of residents who are skewed a little bit older, who typically, this is the high-risk population, who have really paid attention to, the guidance that's been put out by the health department and the CDC for what needs to happen. Kent County is doing fairly well at this point. Our positivity numbers are consistently below the state. Oftentimes, many days it's half the rate of the state. If you're interested in seeing those particular numbers, they're posted every day at 10 o'clock on the Maryland coronavirus web page, which is run by the Maryland Department of Health. It's information that's available for all to see, and if you're interested in tracking it, it is there, and you can bring it up by Kent County specifically.
What are the metrics needed to achieve in order to end the state of emergency that began in March?
The Maryland Department of Health and the governor are tracking multiple metrics. The three most important are positivity rate, and that's the that's the percentage of positive test results on a 7-day average. The next metric is the number of cases per 100,000 of a population. And the third metric involves hospital utilization. They're looking specifically at the number of admitted beds and the number of intensive care unit beds that are being utilized on any particular day. As you can imagine, statewide there are a fixed number of these resources, and if utilization goes up to the point where surge capacity has to be activated, then we would hopefully we don't go there, but those are the numbers that we're looking at, and the governor specifically. In terms of what threshold is required to end the emergency, I'm not aware of one at this point. That's going to be up to the governor, but certainly now that this infectious virus is here in our population, it will be for many years to come. And I think that the state of emergency will depend to a significant extent on those metrics, and also the ability for the health department and the scientific community to deliver a vaccine for this particular disease. For the virus. And once we have statewide low numbers and we have an active vaccination program, then in all likelihood we will be able to move forward with it as another another infectious agent in the pantheon of viruses that we already have.
Outset of the pandemic, Kent County nursing homes were hit hard. What is the state of nursing homes in the county today?
Nursing homes and long-term care facilities are currently some of the most regulated healthcare organizations that exist in the community. They're required to have all of their staff tested weekly. If there are cases within the resident population, the residents have to be tested. Fortunately, we have been able to control infections in the nursing homes, and the nursing homes have largely done that themselves with increased vigilance related to infection control practices. They have the highest risk population for bad outcomes if people get infected, and that's why we saw such a devastating experience with some of our nursing homes in the county. Recently, our 3 long-term care skilled nursing facilities, have met the requirements to start relaxing the restrictions that are in place for them. They're permitted to have outdoor visitation. They're allowed to have certain, small group activities happen within the nursing homes. I do know that we keep we have a regular communication, the health department does, with leadership of all 3 facilities, and that we're keeping an eye on them, because I'm concerned that if it gets into this population, we can have a bad outcome. And after the first surge, we have been able to, with the help of the nursing facilities and the Office of Healthcare Quality, we have been able to really make significant improvements.
You voiced concern at a recent Kent County Commissioners meeting about the arrival of Washington College students. What is your concern about the influx of this age group?
In the last month, the most active demographic for infections has been the 18 to 29-year-olds. It has, that is squarely within the age range of most undergraduate colleges and universities. We are concerned that obviously that the students at Washington College come from all over the country, and that they potentially could bring the virus into our community. One of the things that I can say is that the leadership of Washington College has worked closely with the Kent County Health Department to craft a plan for their students working, living and studying on campus. They have a number of fairly sophisticated tracking, applications that students use on their smartphone to check in daily. College students are colleges and universities have had significant outbreaks, and Kent County is no exception. And what we're doing here is we're building a collaboration with Washington College to help deal with the inevitable arrival of the students and of the virus. And at this point, they have been very successful at working with their 300 students. One of the things that we have is, our population is about 19,000. When you introduce, approximately, 1,900 college students, that's a 10% increase for our demographic and for our population here in Kent County. And we're concerned that it is, that's a demographic where there has been a lot of spread recently. It's also a demographic that is not significantly impacted by the virus if they get infected. They may become symptomatic, they may need to see the doctor, but in all likelihood, the majority of those individuals will come out the other side no worse for wear.
What practices do the public need to adopt to survive COVID-19 this fall and winter?
We encourage everybody to continue with the practices of social distancing, wearing a mask when you're out in public. If you are in a high-risk demographic, somebody who is over the age of 60, has a pre-existing condition like hypertension, diabetes, that you carefully weigh your decisions to go out into public and what you do with the people that you socialize with. Hand washing is important, and hand sanitizer. Use the hand sanitizer. Wash your hands. Wear a mask. Be very careful about social distancing and the gatherings and events where you go, because the more public exposure individuals have, the greater the likelihood of contracting the virus. One other thing that I will say is that this isn't necessarily COVID related, but we encourage everybody to get their flu shot. This fall. This year, it's always important to get your flu shot, but this year it's particularly important because what that allows you to do is it gives you immunization, protection from the flu virus, and that's not at all related to COVID-19. But what it does allow the community to do is that it reduces the likelihood that you'll get sick and require healthcare resources that could potentially be needed for somebody who does become infected with COVID-19.
It has a conservation effect then?
Correct, right? Correct. I mean, there's a limited amount of healthcare resources, and if we can prevent people from getting sick with the flu, and those resources are available to address a surge in COVID-19, then our community is better positioned for that.
Bill Webb, thank you for joining us.
Thank you.
And on behalf of the Kent Pilot, I'm Steve Meehan.